Hello everyone, I am Dr. Bharat Mishra, Professor and Head of the Department Nirmala College of Pharmacy under Kerala University of Health Sciences, Kerala. I am here to discuss some of the fact of COVID-19 with you all. In the past 100 years or more, in spite of medical advancements, have we come forward from living in a constant worry that merely a cough or fever might be a death sentence? Despite all our medical and technological breakthrough, when dealt with the prospect of an epidemic or a war-like disease state, we are not that different from prehistorics. The whole world is prepared that how to deal with the atomic attacks every country is preparing for. But we fail to protect ourselves from these tiny cells. Right now, the entire world is threatened and witnessed millions of deaths by COVID-19 pandemic. But the history of deaths by viruses are not new. There were pandemics and epidemics in past and recent past. The past 10 years alone have seen major outbreaks of swine flu, the Ebola, Nipah, and Zika viruses, and even the resurgence of plague in various parts of the world. Even today, along with the novel corona outbreak, there are serious threats of Ebola and Zika viruses are coexisting in some part of the world. If you've seen the recently Republic of Congo has been found some of the cases of Ebola again. From the past time, there were millions of deaths. Various deadly viruses attacked us. If we importantly mention as HIV/AIDS pandemic, that time period is around peak time period of 2005 to 2012. Number of deaths 36 millions. The Hong Kong flu pandemic in around 1968. Number of deaths 1 million, caused by H3N2 strain of the influenza. If you go little more behind in the history, the horrible situation will be seen. For example, Asian flu 1956 to 1958, number of deaths 2 million. Flu pandemic 1918, number of deaths 20 to 50 million. Sixth cholera pandemic 1910 to 1911, number of deaths 8 lakhs plus, and so on. Whatever I am talking, these data are the WHO data. You can find in the WHO website. So this history is a long history. So these numbers are keep on growing. Other than these, there are a number of deadly viruses who have attacked us time to time and killed millions in recent past. For example, chikungunya, Crimean Congo hemorrhagic fever, Hendra virus infection, Lassa fever, Nipah virus infection, Marburg virus disease, MERS CoV, monkeypox, SARS, yellow fever, and now novel coronavirus, COVID-19, etc. So it's a long list. The current fight against COVID-19, it's going in phases. Sometimes it looks like everything is in control, but suddenly some new news comes and we feel like, no, it's not in control. So to make this fight against coronavirus is becoming more challenging now, as the detection of infection can be done by the symptoms, as you know, for the dry cough, high fever, joint pain, vomiting, and breathlessness. But now the virus have gone incognito. There are cases all over the world are increasing in number. By some modifications, this particle has changed itself. This particle become more mysterious, as there are 80% cases as recently found in one part of India where there was no symptoms. But there were some other symptoms which resembles with the non-infective diseases. For example, some psychological distress symptoms. Asymptomatic transmission refers to transmission of the virus from a person who does not develop symptom. No fever, no gastrointestinal issues, no breathing issues, no coughing, none of that. As you might imagine, it is hard to find when someone has a disease but shows no sign, because that is the only tool we have to find out the people. Actually, asymptomatic and pre-symptomatic cases are responsible for a lot of transmission. This is the fact. I want to share one more news to you. A very recent article published by Rong Yin in Journal of Medical Virology to report a rare case of patient diagnosed with COVID-19 who manifested with concomitant neurological symptoms. The patient developed fever and respiratory symptoms at disease onset, followed by muscle soreness and subsequently altered consciousness and psychiatric symptoms, with positive signs based on neurological examinations. So, can we predict now that this virus has started attacking the brain? Yes, there are cases, there are reports which are giving the proofs of it. So there were no symptoms of corona infections, but there are symptoms of psychological distresses. A study published by the Journal of the American Medical Association Neurology found that 214 patients in Wuhan, China, more than a third of patients had neurologic symptoms like loss of consciousness and stroke. Dr. Jonna Fifi, the Associate Director of the Cardiovascular Center at the Mount Sinai Health System in New York City, said the hospital is seeing more patients than normal with large stroke, and the patients are there in 30s and 40s. So there are threats, very serious threats. It seems it's not going to get over here. It seems it may leave its mark for future generations too. I would like to draw your attention towards one continuous discussion about the uses of SARS-CoV receptor angiotensin converting enzyme ACE2 for entry into target cells by COVID-19 agent. So what if use the ACE2 inhibitor for the treatment? What if the patient is taking ACE inhibitors? But there are certain facts. As ACE inhibitor lisinopril and angiotensin receptor blocker losartan can significantly increase mRNA expression of cardiac ACE2, and then patient therefore more at a risk. Some suggest decrease the level of ACE2 in cells might help fighting the infection. Is it so? While one more observation creates the confusion, as the ACE2 has been shown to have a protective effect against virus-induced lung injury. Now what? If you block it, this protection will be gone by the production of vasodilator angiotensin 1 and 7. The question is, will the most superior human be dying in millions whenever these novel microbes attack us? Can we do something to prevent these situations before they arrive, or at least to deal effectively and quickly to minimize our loss of lives? Can we find out some kind of pattern or environmental similarity for these viral attacks to crack them down before they appear? Are we prepared? Are we preparing enough? These are big questions. I want to leave you with these questions and with the words of Cynthia Radu. What she said: If you want to panic, go right ahead. It's what we do. It's what our ancestors did. Then be afraid. Eventually, however, roll up your sleeves and get to work, scrubbing this bug back to whatever its host species happens to be. We'll get there. Humanity has so far survived every microbe that has jumped the species barrier, and we will survive this one. With a lot of positivity, I leave you all with these words: be positive, but don't be corona positive. Thank you.